Good morning, everyone. I hope everyone is having a wonderful Wednesday. And thank you all for joining us for our first webinar of this fiscal year. And we're excited. I am Megan Greenwell, and I just joined the Governor's Office of Early Childhood's team. And I'm so excited to be able to have the opportunity to work with each and every one of you all. So we are going to get started right now. It's 10 o'clock, and I know your all's time is precious, and I don't want to keep anybody waiting. Hopefully we'll have a few more join in shortly, but just a few housekeeping things. Just remember to stay muted to prevent background noise and that kind of thing. Feel free to have your cameras on. We love to see your faces, but don't feel like you have to. Utilize that chat button down there at the bottom for any questions that you have during discussion, and we will answer those or discuss those towards the end. And anything that we might not have time to get to, we'll of course address at some point, but use that chat button. Use your reaction buttons down there at the end to show love and support, or if you have a question, raise your hand, that kind of thing. And
yeah,
are there any questions or anything before we get started? Does anybody have any technical difficulties?
for imprint.
And I shared my contact information down there in the chat. Please make yourself my best friend, because you all are going to be my best friends, and we can't do this without you all on the ground. And for all the children of our Commonwealth, that's our main goal, is to be there for our kids and to better their lives. So I'm sure a couple people are still joining, and I will monitor that. But like I said, use the chat button for questions and discussion. And without further ado, I will introduce our Executive Director of the Governor's Office of Early Childhood, Ms. Amy Neal.
Good morning, everyone. Megan, can you hear me?
I can.
Okay, so I am breaking such a rule this morning, and I've got my camera off because you all do not want to see my background. The past 2 days I have been moving, and you do not want to see my background. So at any rate, I'm going to go ahead and kick off the show. I know we're going to have some late folks. You guys are super busy in your world, because right now we only have 37 participants, and that is super low for us. So I feel sure that we're going to have some other folks join. For those who are already on the call, we just want to say thank you so much. Right off the bat, I can see one of our Early Childhood Advisory Council members, Dr. Amy Hood. If there are others, I apologize. That's the only person I see right now. But Dr. Hood, thank you so much for your leadership on our advisory council, and thank you so much for joining us today.
Thank you very much.
Thank you, Amy. So just a couple things, and then I've got a couple slides, and then I'm so pleased to be able to turn it over to Fayette County, and we're going to highlight some excellence in the field. But right off the bat, you met Megan Greenwell, who is new to our team, but heck, she jumped right in, both feet, and she's a veteran working for the state. So she's really not new. She's just new to our team. So welcome, Megan. She's already done a really terrific job. Lynn Baker, who many of you all likely know, has a great deal of experience and expertise in the early childhood space. And we were just absolutely thrilled when she accepted the position. Lynn is going to be leading in the space of early childhood workforce. Thrilled to have Lynn on board, and she's again done an exceptional job. Rebecca King, you all have been working with Rebecca if you're joining us for the Early Childhood Institute. Hi, Rebecca. There she is, doing a bang up job. And she's now officially joined our team. Love having Rebecca on board. And she's not here, but on Friday, Rosetta Devine will be joining us as our administrative assistant because we have grown so much in the work of apprenticeships, and we're expanding the work in our apprenticeship portfolio. Amanda Atkins will be moving into a coordinator position, and so Rosetta Devine will be moving into our administrative assistant position. So that's our update. So try to keep track of all the puzzle pieces, keep moving around. But our point always is to be your partner in the work. And no matter who's here, what our names are, it doesn't matter. We're partners in the work to ensure that all children have a strong start in the Commonwealth. So at any point in time, you reach out to us. Doesn't matter who's on our staff, we're here to help you. So Megan, you want to go ahead and pull up the couple slides we have, and I'm just going to walk you through just a couple reminders of who we are, what we do, and where we're going. So the first one is really around the original goals of the Kentucky Governor's Office of Early Childhood. And I love to just really ground us in the original goals. The next slide, Megan, which were really around promoting greater collaboration. And the second one was around emphasizing quality. We've added continuous improvement because we know how important that is. And then ensuring more children enter kindergarten prepared. That first one, promoting greater collaboration, is really around that state and local partnerships. But as you know, our mission is around maintaining a comprehensive and sustainable prenatal to 5 system for all children in the Commonwealth to ensure a strong foundation. Next slide. And, you know, Kentucky can really be proud of its work since its inception of the Early Childhood Advisory Council. It's really always been a catalyst and change agent. And Dr. Hood knows that. She's been engaged since the beginning. And really, several of you on the call have been around since the beginning, right? And so you know that we've really always been a leader in the work, going all the way back to the year 2000 with that Kids Now legislation. Kentucky was one of the very first states to establish early childhood standards. And then we defined what it meant for Kentucky for children to be ready for school. And then we put in place the Brigance, and then we got the big grant from the Race to the Top, and so on and so forth. But you know, one thing I will tell you that I think is really important is that across the country, many states house various early childhood programs and services and agencies. The way they house them, it varies significantly. And what our office does as the support entity for the Early Childhood Advisory Council is we really serve as that oversight and coordination body for the Cabinet for Health and Family Services, the Kentucky Department of Education, and Education and Workforce Development, because as you know, those are where all of the early childhood programs, services, supports, funding, all of those are coming from, right? So the Early Childhood Advisory Council, and then its support office, the Kentucky Governor's Office of Early Childhood, we're that coordinating and convening body. We're working to ensure that we're all rowing in the same direction. Because if we're not, children and families have a much more difficult time accessing services and accessing opportunity. I think the last thing I just wanted to mention about this is that very last circle, which is our roadmap. And the preschool development grant allowed the Kentucky Governor's Office of Early Childhood to develop a 5-year strategic plan. And for us in the state, it's a fantastic opportunity to facilitate collective commitment across the state to increase access and opportunity. And that's exactly what we've been doing with your partnership over this past year. Next slide. So this is the why. This is why we do the work, right? If we could change the first 5 years, we would change everything. Kindergarten readiness, third grade, they're highly correlated. We have been flat for the past 5 years at kindergarten readiness. We're not even talking about that little thing called the pandemic, right? Third grade reading has hovered around 53%, third grade math around 47%. Everybody on this call knows, right? We've got to start prenatal. That's where it all starts. That's why we're all working together to build that sustainable, comprehensive system. Next slide, please. You know, I couldn't have this time, and I don't know how I'm doing on time. Brenda's our timekeeper. Brenda, how am I doing on time? I don't know, but I had to just share with you all the great work that's going on. And even after this really tough year, we have done a great job with the support of our partners. More than ever, we are using data to drive decision-making, and we're working to elevate and amplify strategies that have the biggest impact. We had over a 108% increase in apprenticeship employer partners. Outstanding leadership from our office. Again, I spoke to it in the very beginning. Brenda Hagen is a sheer expert in this space, and what opportunities we're providing for our practitioners. We secured a $2 million funding stream from the Division of Child Care to expand our portfolio. We've identified, with the help of our partners, 7 data-driven bright spots that we're going to talk a lot more about here in just a couple minutes, but you all saw these in the RFA this year. And what's the point of finding something that works and not growing it, right? If we know what works, let's do more of it. Let's grow it. Let's provide more children and families access to it. So now we're up to 46 participants, but again, that's a low number. So there must be big stuff going on in schools and communities today, because over this past year, we had a 150% increase in engagement in these webinars. Folks were very, very engaged in this training and technical assistance. And here's the goal, you all, and we need your help consistently, is our goal is to get every Birth to 5 partner engaged in these webinars every other month. But again, in the year of the pandemic last year, 150% increase, not too shabby. And again, talking more about this today, but we are so fortunate, Kentucky is, we received an additional close to $6 million of tobacco settlement dollars this year. And we've built a plan for this money to be invested across the Commonwealth for children and families to grow a proven strategy over time. And then last, we focused very, very much on our leadership. We have 26 appointed members for our Early Childhood Advisory Council. They've been appointed by the governor, and we have been very strategic about having those folks lead committees, engage in conversations, help us make decisions, and really help us lead the work. And we're really proud of that. We know they're very busy people, but we also, they were appointed for a reason, and they bring a lot of expertise to the table. And so we're really leaning on them to help us facilitate the work. And I think we're on the last slide. And here it is. This is what's so exciting, you all, and it's because of you all that we can do this, is that I'm just going to go ahead and share that our theme this year really for the webinars and training and technical assistance is growing, is elevating and amplifying, growing excellence in the field. So how do we take what's working and do more of it, right? So after 20 years of community early childhood councils and some really good stuff that's gone on and some great bones, some great partnerships, what's next, right? If we look at our data and we're still at 50% of kids not ready for kindergarten, if we continue to operate exactly the way we always have, then we know what's going to happen, right? We're going to get the same results. So how do we build on our strengths, which we have a lot, and then take that next step, right? Operate differently so that we can get different results. And so one thing is, in 2019, the Early Childhood Advisory Council took the opportunity to really streamline the community early childhood councils, and they took those from over 100 community early childhood councils to 30, 32, or right around that number of regional collaboratives. And so you may notice that our language is changing, okay? So we're really calling them regional collaboratives a lot because they're aligned to the workforce investment boards. And the reason that the Early Childhood Advisory Council did that was all around the opportunity for alignment, which, we could go on for days about the benefits of alignment around decision-making and resources. And, so we're not confusing the customer and visibility and optimizing resources and all of those things, right? So now we're down to about 32 regional collaboratives, right? And our goal this year is to build off of what we did last year and to provide these free webinars, this free training, this free technical support. We've brought on a consulting arm, Compass Evaluation. We're super excited about that support that we're going to be able to offer to our partners. And it's all about impact and innovation. And our goal is to support solution-oriented discussions, highlight and grow excellence in the field, and build capacity and new leaders. So that's a lot, but we've got a lot of work ahead of us. So I, again, want to thank you so much for taking time out of your busy schedule to spend an hour and a half with us. And at any time, our office is here for you. And now I'm very pleased to turn it over to Iman Fitzgerald. Oh, no, I'm not. I'm turning it over to Megan, because how can we do a webinar without learning objectives? So turning it over to Megan.
Okay. So our learning objectives for this webinar, before we jump in with our Compass team, as Amy introduced, and our excellence in the field example, Eamon Fitzgerald. First, we wanted to highlight what our objectives for this webinar are, and that is to get smart in designing your goals and your outcomes, elevate and amplify your existing work, which will be our concurrent theme throughout our webinars this year, and look for those bright spots, which we're going to hit more into this webinar as well, and which all of you all are very familiar with. So without that, I will introduce Sarah and Iman, and I'm not sure if Kate is joining us or not, but she is also with Compass. So we can get started.
Good morning. Iman, I think you're first up, so I'm going to defer the mic to you to get us started.
Sure. Well, thanks everyone for being here. And I appreciate when the governor's office of early childhood says excellence in the field. I never think about that as in like we're done, like we've achieved everything we wanted to achieve, because that is far from it. Obviously, you can see the data which we use to drive a lot of things. But I do think that one of the things that early childhood hasn't always had the opportunity to do is to share information with other folks in the field of early childhood education. So taking the things that we've done well or the things we have not done well, especially, and share with you all is definitely something that we always try to do and learn from. We do it amongst ourselves a lot here with the Fayette County Early Childhood Council, with the idea that we're always looking to improve and help children and families, which is kind of the end goal here. So they asked me to talk a little bit about kind of action planning. I think because I've been with early childhood councils for a really long time. I've seen a lot of different iterations of kind of action plans, leaning really heavily on the SMART goals that Ms. Sarah mentioned in one of our previous webinars. So a lot of things with the webinars, with the action planning that we looked at is kind of, the things that we learned the last time is the who, the what, the when, the where, the why, and the how. And how our action plans have been written kind of previously. What Ms. Sarah talked about in terms of who writes the action plan. Well, we always open it up to everybody that wants to take part in it, whether they are a pro at this or whether they're a greenhorn and want to learn the process. And then we kind of narrow it down from there. There's always, a handful of people that want to help, and then it narrows down to the people that can actually help, or we can, have the time to, because we know folks in our field are kind of stretched thin. And then in terms of what's needed, for us, what's needed, we look at a couple different things. We look at data for sure, data across the state, data in our own county. And when we look at that, we also look at kind of in terms of who's writing it or who we're asking for help. Is we try to make sure that we always kind of run the gamut of history in terms of early childhood councils here in Fayette County, who's been doing this for a really long time, and versus who's been in the field for a little while versus kind of the folks that are brand new. We look a lot at the history of the people that have been doing this for a long time to see what they've tried before. All of our ideas have never been brand new. They've always been different iterations of ideas or thoughts that people have had in the past. Just sometimes things get updated and changed. For example, connecting with families has changed drastically in the past 5 years through the use of social media and things like that. So, but the idea of connecting with families is not new. It was not our idea. It was something that was always there. How do you reach families all of the time, where they are and not just where we are. So we look at kind of what the criteria is needed. When should we create an action plan? We kind of take notes and look at things throughout the year. But of course, everybody cranks a lot of things out the past, in the last couple months of RFA planning. But we really look at when something good happens, we try to talk about it then and there, and it doesn't always happen in an ECC meeting. Sometimes it happens in the hallways of a school, or it's even happened at at restaurants where we'll run into somebody that we know and we'll talk about, hey, do you remember that thing? We should really look at including this in ECC. So when definitely set aside time, but don't discount the kind of the like we do with early childhood, these kind of, teachable moments that we jot things down and text each other and write notes in our phones. In terms of where should I do my community-based planning, in the community, it just kind of like what I said, it's easiest done when you're in the community. And then through Zoom's been really nice because we get a lot more people for a little bit more time. We don't have to plan so much about traveling back and forth. You can really kind of sit down and kind of, eat and digest all of the ideas that we have. And you can record it. So, you don't have one person trying to write down every, you don't have a note taker that's using giant pieces of chart paper. You can record it and then go back and review it as many times as you want. So that technology piece has been nice. And then the why, why are we developing the action plan, for education? It's to measure, process and progress. Why are we developing the plan that we have? And then how do I write an action plan? This is another way, another piece where we leaned heavily on the folks that have done this in the past. The folks that have been doing this for a long time, and they have a wealth of knowledge, but maybe not the time or the energy to write the action plan. But that doesn't mean they can't help in some capacity. You can bounce ideas off of them. We have, a retired lady here in Fayette County who has been an advocate for early childhood for a really long time, and she can't make all the meetings, but she said, text anytime you have a question. So we'll say, what's the history behind trying to do this? And she'll call or she'll text, and be happy to kind of give her expertise. So make sure you lean heavily on, folks that have done it in the past, but also the energy, of the folks that are brand new, that are ready to try these things and really make a difference. So one of the things when it comes time to writing, I think there's always room for improvement. Ours aren't perfect. They're definitely a place to improve. One of the things that we always try and balance when writing our goals is, how strict are we making them versus kind of how loose are the goals in terms of, and that's a delicate balance that is individualized for every single county. What works here will not necessarily work everywhere else, and vice versa. We've learned a lot from other counties as well, listening and talking to folks and reaching out to other council, officers and just folks in the field. But for us, when writing a goal, for example, in the past, we've written certain goals such as, have a very specific face-to-face, early childhood professional development weekend, which is great. We know how many people we can serve. We know trainers. We know all those kind of things. We know how many hours we want to offer. And then things like the pandemic hits, and you can't have those face-to-face. So we have written things a little looser in terms of, early childhood professional development event, whether it's virtual or face-to-face. We'd love to do face-to-face, but sometimes, especially in Fayette County, for example, with the, rise of cases of COVID, those are things that are just not doable. But, thinking, and the nice thing about writing things a little looser is that there is a little more room to pivot. You can always, have meetings and vote and try and restructure things and reallocate funds and do that very important appropriate paperwork that the GOEC will help you with if you need. But it is something that if your end goal is the same, how you get there can be a little looser. Any questions? I'm talking really fast because I don't know how much time. I'm waiting for a text to see how much time that I have left. Miss Sarah, anything to jump in there?
Well, when I partner with local collaboratives and local groups, it is a partnership. And as we walk through the next example, I really rely on my local partners to push back, because I'll, as you'll see, I'll approach kind of goal setting in a certain way. But what we need to do is we also need to know what's realistic, especially when there's a pandemic or if there's something's going on with the economy. So I think in this next example, we're going to show an example of a goal, and then we'll talk through ways to potentially strengthen it. But I'm definitely going to encourage it's to say, look, that sounds great, but that's not where we are right now. And that's where we're kind of operating on continuous improvement, is we're always seeking for something that's aggressive yet still achievable. So Fitz, let's walk them through the example.
So this was one of ours. This is one of the first ones. Similar, very the same as what you all have, encouraging partnerships of licensed childcare centers, certified family homes, public preschool providers that provide high quality learning environments for children who reside in our service area that are covered by your council. For us, our goal was, so this is where we could use some improvement. I think we focused really heavily on what we were going to do when we were going to do it, but not really rewording kind of the goal there, the outcome and the goal. And so the goal, of course, is what are the council's goals to reach the outcome? Ours was to utilize a kind of read, talk, play communication campaign, utilizing kind of countywide campaign, encouraging of all partnerships. For us, when we said, all partnerships and all partners, we were thinking families, we were thinking, providers, all providers, family, childcare, public, preschool, private, everything, as well as just partners within the community. Whether or not they have a stake in early childhood or not, and most people do in some capacity. Maybe they just don't know it yet. But they, we are thinking community-wide as best we can. So in terms of measurable, we talked about metrics and data. Social media is something that we use quite a bit. So looking at that data and looking at data, not just from our usage, but what other, early childhood or even kind of early education folks are using. We relied heavily on data that was published by KET and PBS Kids in terms of social media usage. When things like when are families logging into Facebook and Twitter and Instagram. And we learned that a lot of early childhood families and providers don't use Twitter as much as they use Instagram and Facebook, for example. We learned about kind of when to post things, not posting 5 or 6 things at the same time. When do families spend time, using social media as well as other things? We didn't want to just kind of, when we talked about our campaign, didn't want to just talk about social media. We looked at we've tried everything from social media to billboards, which I know a lot of folks have done in the past. We do yard signs as well as during the holidays, we engaged our local mall. Well, this is pre-COVID. We engaged with our local mall to have signage put in the mall. Because, I kind of shudder thinking about it now because of COVID and everything. But we did a lot of placement of ads and how to connect with families at the play place that's at the center of our mall, where all the kids come and play for hours and stuff. Other members of their family shop. And I think about, we think about germs even more now and masking and stuff like that. But that was something that we tried. That was a part of our kind of campaign where we were flexible enough, some may say loosey-goosey enough to try, not just saying we're just going to do social media or we're just going to do this type of media or billboards, is that we're going to try a few different things because, Lexington is very diverse in terms of how people get their information, where people get their information, and things like billboards, while some people say, well, billboards don't work anymore, they helped us, reach a couple really big partners who wanted to have a stake in early childhood. So in that case, it was really successful, in terms of kind of our, as I call it, our loosey-goosey writing. Let's see what else. Was it achievable, and kind of the relevancy of, our social media campaign. One of the things that we did is we utilized a marketing company, a marketing firm, just because, it's one of those things that if it was going to be countywide and if it was going to be really cohesive and beneficial, we turned to the experts, and that were a group of individuals that their marketing and social media was their background, but they also had very young children. So they had an additional kind of stake into what we did. In terms of kind of time bound, we could be more specific in terms of time bound. We did say, between essentially the fiscal year. But, as we get information, we're able to collect, new information as it arises as best we can and share that with everybody. So that's been nice about social media. So you guys that do use metrics and everything, that's been something kind of very easy to collect and kind of visually can show folks very nice in terms of data and metrics and kind of visually show how many families, were they using it. Now, you also have to weigh your metrics up against kind of the anecdotal information, kind of those gotcha stories. It may only reach 30 people, but if 2 of those families make a drastic change in what they do to benefit their children, it's a win. And we figure out why that worked and kind of, go from there. So what else? Ms. Sarah?
So I think the first thing that Eamon and I talked about when we reviewed just this one outcome area is that for me, what's listed as a goal sounds a little bit more like a strategy. This is what we're going to invest our funds in. We're going to do these things. We're going to utilize this. We're going to utilize a campaign. Those to me read as strategies. And I wondered if the goal wasn't more, in fact, what Fitz has listed under the specific column, where we have this idea of all members will have access to a community campaign that encourages them to do what? And it's that what that's going to help us move towards the outcome. So let's advance to the next slide, because we have a little bit of a formula for approaching this type of work. And it's kind of a formula for making SMART goals and outcomes. Can you think in these terms? By some point in time, at least some percentage of your target population will experience or document some condition that can be measured, right? And traditionally, we see this as a way to write outcomes in a way that we know that we're getting really specific and measurable things, but it also applies to goal setting because it forces us to think about dates. How far in the future is your goal? Does it fall within the time frame of the grant? Right? Is it a 5-year goal or a 1-year goal? Who are your targets? Are you targeting everyone? Or are you only targeting a certain subpopulation? Why? What do you want your target population to do or experience or grow that's going to help make things better, right? And then how do you know that you're being successful, right? What data exist or don't yet exist to help you track your progress towards that goal? Understanding that there is no perfect. We're always just in a process someplace. So here's an example that I pulled together, and then Fitz, I'm going to toss it back to you to say how to kind of talk through how we might rephrase your goal or change it up. I'm also going to trust you to push back and say, look, this just isn't realistic for the work that we're doing right now. Okay, but here's the example. I've chosen an example that's a few years out in the future for by 2025, I want all young children. My goal is for every young child in my area, in my collaborative, to receive an annual developmental screening with its appropriate follow-up. And I'm going to measure that using some unknown data source, right? Some kind of standardized data source of screenings. And this is my goal because it's going to help promote child readiness. If we can screen and find developmental learning needs early, then we can address them and help children become ready for school. And then I also threw in that this represents growth, that this actually is progress because I have a statistic for right now, and I have this projection for where I'd like to be in 2025, okay? This is just an example. Let's go back a slide and kind of keep this formulaic approach in mind. And I think fits, of our outcome, what we're trying to achieve is this partnership among licensed centers and homes and public preschool. We're trying to achieve a partnership there. That's kind of our ultimate outcome. What springs to mind for you on how to rephrase your goal, if anything?
Yeah, and this is something that we're happy to talk about. And I definitely think that rephrasing the goal, and like you said, utilizing what we have currently for the goal is more the kind of the specifics. But in terms of kind of rephrasing the goal, it would be that utilizing FCC, CC members, I think members of the community, which include families, child care providers, countywide partners, will encourage, use, I don't know, help me out with the wording there.
So I love the idea of having a specified target group. It's not just everyone in the county, it's your FCC, ECC members, and that you have a goal where all of your membership will be exposed to this campaign that encourages partnerships. And I would add partnerships in support of what, because with networking collaboration, there are all different kind of nuances of partnerships. You can have some partnerships that are a heavy lift and some that are a light lift. But I think as I read through this, I said, I think what's under the specific column reads to me that within a year or two, or, let's say by the end of next year, all of your membership will have been exposed to this campaign that encourages partnerships in support of higher quality, right? And so just kind of using that as a sample, then these utilization statements really help me understand how I'm going to spend my resources in support of achieving that goal. And then we also can check in with data. How do we measure that? How do we know where we are now? And how do we know that we can recognize progress, right? How will we be sure that all of the members have exposure to this campaign? What kind of data will we collect? How will we understand their reactions to the campaign? Is it achievable? We like to, again, balance the idea of what's aggressive with achievable. And very often that's, you're taking a guess at that. You're hoping to get something that's moving you forward, but is still achievable in the amount of time and for the amount of resources you have. And something that's clearly relevant to child development and can be accomplished within your specified time frame. So, but that's me, and it's easy for me to say sitting on the outside. So I always trust my partners to push back and say, that's a step too far. Can we modify it back to something a little bit gentler, something that is still aggressive, yet we're more confident is going to be achievable. Fitz, that was a lot of words. What's your reaction?
I think that's great, and I think the comment in the chat really kind of is the one thing in terms of pushback is since we are only funded coming from year to year, and sometimes those the
excellent point.
Structure does change. Thinking so far in advance in terms of the collection of data versus what you can have kind of immediately, it does get gets a little hard and kind of hard to focus. But no, I thank you though for the kind of the restructuring, rewording of the goal there that I have.
Well, and I'm as a data person, I love thinking about data, but data costs money, right? So part of this equation is also saying, when I think about what's measurable, what can I afford to measure, and what's measurable within a 1 year time frame? To Amy's point, you're funded 1 year at a time, so you've also got to be conscious as to what amount of change. When you're setting your goals, what's aggressive yet achievable within the amount of time that you have set aside, and how can you afford to measure it as well? So we like to set goals that are manageable as well. And sometimes that involves walking back from the most aspirational goal you can make. Sometimes it's walking that back and say, how do we achieve this one step at a time and still have a solid goal? Questions from participants. Let's open this up for questions and pushback. I think one of the reasons we wanted to introduce this now is that we're hoping to get good practice on this at the ECI. So Megan, can we go on to the next slide? Yes, thank you. Part of what we wanted to do today is run through some tips and some strategy for making the most out of the ECI. And a question here in the chat box, what is measurable also relies on multiple entities having equitable access, supports, and resources to gather data. Absolutely, absolutely. And I think that's more often than not where and how I get pushback from the field is it's easy for me to come in and assume that data are just magically available. And we really have to talk through setting goals that actually can be measured. They're achievable, but we also can document our success. And I really rely on my partners to push back and say, you know, it's just not there. What else can we do? Or how else can we measure something? Or how else can we approach this? Because here's the reality on the ground. And we have to partner together to figure out a statement that everyone can live with. Right. Let me pause for a second and just allow for more questions or comments. And the good news is that we're going to get lots of practice at this at the November ECI. So everyone has something to look forward to. We're not going to kind of set you free on some of these concepts, but we're going to have some facilitated discussions at the ECI that help guide you through this process and help kind of discuss some of these ideas in more depth. So how can we get the most out of the ECI, which will be in just about a month, a little over a month? Well, what will you want to bring with you? You want to bring with you your critical partners. My first slide on this was to remind folks that there were limited spaces available. Rebecca King, if you're on the line, are there any available spaces at this point? What's the current status on availability?
4 spots left.
All right, 4 spots left. So think through your critical partners, think through who's going to have a very rich and challenging discussion at the ECI, because this is the time to really hash out what's aggressive yet achievable, what's measurable. And we really need to have that type of rich discussion at the ECI to develop a strong plan. Okay. We're going to recommend community discussions. You have October of 2021. We are going to recommend that we also have some community discussions on these ideas, and we'll have a collaborative planning guide that's coming out to you early next week that can help guide these community discussions. You should bring with you what's current, your current application, your current budget, your current member list, any subcommittees or other groups that might be working in your communities, any previous grants. So these are all things to think through and perhaps bring with you as you prep for November 21, the ECI. Let's go to the next slide. Okay. So what can you be doing in October? How do we prep to get the most out of the Institute? Well, we're wanting to go through a process of really re-examining and affirming where in your different counties, where are the and underserved communities, with a priority on the youngest children, our infants and toddlers. What are the gaps and areas that need strengthening? But as we'll see as well, what are also the assets that you have that are already working for you? What's already been shown to be important and contributing to progress in your community? Where can you strengthen and use funding to work smarter, not harder, at achieving some of your goals? Really aligning with bright spots and things that have been proven to work in our communities so that we're not always remaking the wheels and we're not always trying to figure out a way to do something new, but really supporting the collective efforts that are already existing within our communities. So figuring out the gaps, figuring out your assets, what's already present and working well, what do you want to grow? Figuring out if your goals are specific and measurable. Are they aggressive and achievable? How can you sustain goals past this 1-year time frame? And then thinking across your entire collaborative and thinking of where there's variance. Are all of your communities the same in terms of their needs, or do you have some priorities within your collaborative of things that need addressing? Some additional supports that will be available for you at the ECI. This is a terrific opportunity to interact with folks from Kentucky Center for Statistics. As you know, they have online school readiness profiles that are updated year to year, but they are absolutely terrific, and they have a national reputation for the work that they do. Other states are very, very jealous of Kentucky having the Center for Statistics. So know that at the ECI, you're going to have access to folks who are experts in thinking through, and they actually have clearinghouses of Kentucky specific data. And a lot of those data are county specific. So if you have a chance, please kind of brush up on what's available for you online, and then plan for opportunities to chat with some of the folks from KY Stats about availability of data and how you might use data to help inform some of your planning. This idea of finding bright spots, these were just some of the examples that we have that were shared in the request for applications for 2022. There are other examples, but these are ones that have really been elevated in our conversation so far. Bright spots such as home visitation as an effective and efficient program for working with parents, especially parents or families that might be in crisis or unstable. The importance of building vocabulary, letter and word recognition. The ability to monitor growth, learning, and development, and that's where that idea of developmental screenings comes from. How do we make sure that every child has access to ongoing health and developmental screenings so that if there is a need, we can catch it as early as possible? Developing early literacy and shared literacy practices, that shared literacy being so important not only for letter and word recognition, but also for bonding between child and parent or child and caregiver. Ensuring that all children who want or need non-parental care have access to high quality preschool, Head Start, or private childcare. Ensuring there are good transitions, that we aren't just, that we're helping to smooth the passage from, say, preschool to kindergarten or from one class to another. How do we make sure that that's a constructive and supportive time for children and families instead of a kind of a disjointed experience? And then finally, how do we blend? How do we take note of what assets we have in our community and blend and braid those together to hopefully work smarter, not harder? So takeaways. How do we get smart in designing our goals and outcomes? And I think it comes down to focus, and it comes down to specificity, and it comes down to negotiating. Someone like myself who will always push for how specific can we get, and saying, no, for our community at this point in time, this is what's aggressive yet achievable. Okay. And the value isn't in one or the other party being right. The value is in the conversation of saying, can we push a little harder? Where's our comfort zone that's still aggressive yet achievable? How do we amplify and elevate the things that are already going well in our collaboratives or in the state? Those bright spots of already evidence-informed and evidence-supported practices that can help us work smarter, not harder. And then finding specific bright spots that may be of interest and may have promise for your collaboratives. Those are, if I had to remember 3 things from today's webinar, those are the 3 things that I would hope folks would take away and chew on in the time between now and the ECI. We are here to help. I hope this is okay with Megan and Kate. This is our contact information. So as you move through the next month, please reach out to us. This is Megan's email, it's my email, and Kate Irish's email. we're here to help. You're not in this alone. If you'd like some one-on-one time to chat through how you might have some community conversations in October, or just kind of talk through what's going on in your collaborative, or just brainstorm some ideas, we'd love to hear from you and we'd love to be of service to you. So please feel free to reach out to us and say, you know, we don't really know what we need, but can we just talk about it? Or if you have a specific need that we can be of assistance on, we're here for you. So please let us know how we can help. 4 spots left, folks. 4 spots. Megan, I'm going to turn it back to you.
Okay, thank you. And thank you to Ian for all of that great back and forth discussion. I think that was really helpful for everybody. At this time, we're going to open it up for discussion and questions. I'm not sure if there's any questions that we haven't addressed yet in the chat box. Lynn Baker is going to kind of help monitor that a little bit. So, but if you haven't already asked a question, here's the time to do so. If you have just a comment, we have some time to do that.
We don't have any yet in the discussion board or in the discussion, but if you guys want to type in or unmute, feel free to do either one of those.
We know that this is not, we know this isn't easy. We know that you all are the grounding roots to what we do here. And we just want to make sure you all know that you're not alone in this. And that's why we're here. We want to help you. We want to make sure you know how important you are. So do we have a question, Lynn?
Kate just said, looking forward to partnering and being a resource for collaboratives. As Sarah said, feel free to reach out to me. And then she reposted her email address right there.
Great. Well, you all know that you can reach out. Are there any questions? Not, I'll kick it back to Miss Amy Neal.
None in the chat.
Can you hear me, Megan?
I can.
Okay, I got booted off my computer because I can't find my power cord in the move. So I'm on my phone and I just want to highlight a couple things I heard. It was a great webinar, you all. Thanks to the team, thanks to Compass Evaluation. But I first want to start with Eamon, and I love what he said in the beginning as he kicked off the webinar about Fayette County is always looking to improve. And I think he said, you know, we're not done. And I just really appreciate that transparency, Fitz, and just thank you for doing that. And we work really hard to, you know, highlight excellence in the field. And Fayette County is not the only high flyer. We have a lot of high flyers out there, so others will be called on. But I just really appreciate that transparency and that you're not done. And then Sarah, I think it's really important too about, you know, all the work we do is about partnerships and trust. And that happens, trust is built through every single interaction, every single day. And so, you know, I heard you saying pushback, but I think of that also as sort of push and pull. And that's about having a strong partnership. And yes, it's about, you know, what's realistic, what's aggressive, what's achievable. But if we're all really working for kids, it's about having those honest and open conversations about what's best for kids, who's the best partner to do the work, what's your role in the community. Like, unpacking all of that is really, really important, but it's like a push and a pull. But you've got to have really, really strong partnerships to be able to do that. And that's our strength in Kentucky. And that's definitely our strength in our regional collaboratives that we build from. Another thing I heard, and I heard it as a flag, and I want to address it. And I think it's a great one. Dr. Hood, I heard brought it up, and then I think there was a little bit of discussion in the chat about, it's kind of hard to do long-term goals when we're only funded, annually. So a couple things on that. Number one, we sort of know what works in early childhood because we've been at this for 20 years at least, right? So we really do know what works in so many instances. Number one. The second thing is, in the preschool development grant, we did our our one and only evaluation for community early childhood councils. And the big takeaway from that is we have to, there's no confusion that we've got to switch from, move from one-day activities to long-term behavior change. Long-term behavior change. That's where we get to lasting change, okay? So that's where these SMART goals come in. And so really, really, we're challenging you to step back and think about what is your community's collective commitments. So yes, our office in years past, it was an annual investment, but remember also this year we're switching this RFA to, it'll be 2 years, but this should not be the only funding stream, right? It should be all of the birth to 5 funding stream. Who has a birth to 5 mission in your community? And we should be thinking, how might we blend and braid all of those funding streams together, right? Because we're looking towards sustainability and growing what works, right? And so I think the last thing I would just say is, what great news again for Kentucky with this additional tobacco settlement dollars. And, our office, the Early Childhood Advisory Council, made the decision, look, we're investing it across the Commonwealth. We're investing it in impact and innovation over the next couple years through our regional collaboratives. And so I would make sure that everyone in your community that's engaged in early childhood understands this, because it's about taking a strategy, taking a data-driven strategy to scale. That's what we're doing. And so it's going to be very exciting next couple of years. And it's all about continuous quality improvement. No one's getting their hands slapped for making mistakes. It's continuous quality improvement. This is how we do the work, right? So that's what I have to say today. And Megan, I think I'm closing out the webinar. I don't have the agenda in front of me anymore. So if I'm not, please jump in and tell me otherwise. I think I just want to thank our partners and friends again and encourage everyone to have a great week. And there are 4 spots left. The other thing that I would say is, even with those 4 spots, I'd go ahead and reach out to Rebecca King and get yourself on a waiting list. That's what I would encourage. So Megan, anything else?
Just be on the lookout for the for a survey following up on the webinar, and I look forward to meeting each and every one of you, hopefully at the Institute. And if not, please reach out in the meantime. And that's why we're here. Let us know what we can do.
Thanks, everyone. Have a great week.
Thank you all.